when moving from civilian practice to this kind of practice, the clinical skills are very much the same, to be honest. It's just the environment that you're attempting to apply them is very different. The leap really is not in changing your clinical practice as learning extra military skills and learning about the environment you're working in.
There's not many things which we do on board than that which we wouldn't do in a hospital. So the clinical skills themselves are often transferable. The real challenge is working within the different environment that the military presents you. But then again, that's one of the most rewarding parts of the job for us, working outside the area in which we're used to. As an anaesthetist, I'm used to turning up to work every day in the NHS, having everything ready for me. My assistant gives me everything I need. I only have to look to my left and there's the piece of kit in my hand that I need. Here we're working on a helicopter that's often tactically flying with a team who are also trying to work within the same constraints, and that's the challenge and the interest for us as well, is taking our own clinical skills and trying to apply them in a hostile environment.
The British Military Hospital in Camp Bastion is a unique Level 1 trauma centre that will bring you face to face with levels of trauma and patient care demands that you will not experience elsewhere in the UK.
Hey there, brother. Welcome to Bastion. I'm Dr. Ritchie. What's your name? Michael. Move your hands. Move your feet. All right, good deal.
Medical treatment in the Bastion Hospital is all about teamwork.
Ready, steady, roll.
What did you have? 100 of fentanyl?
100. I've been given 50 of fentanyl.
50 of fent.
And
100 of propofol.
70%.
Okay.
Here you'll find that resuscitation is more often than not an activity carried out in harmony with the surgical team and the emergency medicine department.
20. So he's having 20 of vecuronium as well, just before he goes round.
So we're going to give him some tranexamic acid now, so we can see how much that changes. This is what we call our Rotem machine, and it's a device which we've got which basically allows us to manage blood clotting problems. So this is from our patient who came in today who'd been shot in the head, and we used this machine to test how well his blood was clotting as soon as he came in through the emergency department. And this trace, which we can see here, gives us a graph of how strong his clot is versus time.
It's not the first time that we've been caught out by this and underestimated something where the patient's been wide awake and seen pretty well, and we've done an X-ray and we've found a bullet where we haven't expected one. So it just shows the value of being able to get a CT early.
His blood did initially start to clot reasonably well, but that after about 20 minutes or so, any blood clots were starting to dissolve again, which is abnormal. So that tells us, and it tells the surgeons, that trying to operate on him right now would be dangerous because any blood clots which form are going to just break down again straight away. So by looking at this, we know exactly what drugs and what blood products to give him to try to solve this problem.
In Afghanistan, post-operative pain management is a rapidly developing field and key to the safe evacuation of patients back to the UK.
There's guys out there on the ground who every day are putting their lives at risk, and I personally believe that they deserve the best medical care that is available.
It does provide a huge deal of reassurance for them, knowing that genuinely expert help is at hand. They always express it to us, the sensation that if they can just keep their friends going until the MERT arrives, then they have a strong belief that they're going to be all right.